Okay, we're going to go ahead and record this for those folks that could not be here this evening. So this is the benefits of xylitol in oral health prevention strategies and beyond for one live continuing education unit, unless you're watching the recording. My name is Dr. Kroling. I'm the Chief Education Officer here at Dental CE Academy. This is a course that I've been presenting since 2013. Of course, it's been updated over the last 10 years. And I will preface this by saying I do have COVID. I've had it for now a week. If you hear me clear my throat a little bit or a cough that I can't control right away, excuse me, I will mute my mic, but it's the best I can do for this evening. Please be sure that you have the handout. And for those of you watching the live presentation, you'll access the handout by tapping on the link in the chat area. There's an orange box. It'll say, "Welcome to Dental CE Academy." If you are watching the recording, you'll need to go to scroll below the video that you're watching, and you'll see an instruction box, and you can download the handout from there. This course this evening has been sponsored by ioTech International's Brand Ambassador Program. I am an employee here of Dental CE Academy. I have not received a speaker's honorarium. I declare no financial affiliation with ioTech International, and no corporate entity has influenced the content of this presentation. Here are the instructions for this evening. Everybody wants to know how to get CE credit, so please be sure you understand. Our presentation is from 5 to 6. At 6 o'clock, Jason Garris, the Vice President of Global Sales at ioTech, will speak for a few minutes about their Brand Ambassador Program. It is not required for CE credit. You can log off at 6 and be redirected to the quiz. Or if you'd like to stay on for a few minutes, you'll be redirected whenever you log out. We'll also send everyone, all attendees, an email at 6:35. That email will have a quiz also, and you'll need 80% passing score. You have unlimited attempts, 7 days to successfully complete. This quiz will expire October 4th, so be sure to get it into us before then. If you need any assistance, you can reach us through our website. You'll see a CE credit verification request. Any questions about the CE credits or any of the instructions this evening? Please feel free to type any questions you have into the chat area for me. So we're going to discuss xylitol's mechanism of action, background information concerning its chemical properties, and then uses beyond oral health. The course objectives are in your handout. History: we know that xylitol has been researched since the 1970s as an effective strategy for dental caries prevention, and it's been endorsed by various agencies, including the FDA since 1963, the Joint Expert Committee on Food Additives, World Health Organization 1993, National Institutes of Health, and various Dental Hygienists Association. And we're here in Arizona, so I do want to give a shout out to Arizona. Okay, so what gives xylitol its unique properties is its chemical structure, molecular structure. The xylitol molecule contains 5 carbon atoms, and as we'll see, 5 hydroxyl groups. It makes it a pentatol. And this is important because when we discuss xylitol, we'll see that this 5 carbon structure is the key reason why many carcinogenic bacteria cannot metabolize it. Here's the properties. Of course, you don't need to memorize this for the quiz, and I will be giving you hints on the quiz all night for the next hour. So the xylitol is basically soluble in water, and its molar mass is very similar to that of table sugar. So if you picked up a pound of xylitol crystals, it would be very similar in mass, or it would feel like you were picking up a pound of table sugar or sucrose. Now, xylitol is categorized as a sugar alcohol or a polyol, or what we call a polyalcohol. It's used often as an alternative sweetener. ITOL denotes that it is a sugar alcohol. So when you see ITOL on the end, like maltitol, sorbitol, xylitol, you can be very secure that it is a polyol. Okay, xylitol has a 100-year history, and its name is from xylose, meaning wood, and xylene, of hardwood. It's widely approved for use in food around the world, and it's also extensively approved, excuse me, about that. The cough was under control until about 5 minutes ago. So xylitol is widely approved for use in food around the world. It's also extensively approved for use in oral hygiene products, pharmaceuticals, cosmetics, and toiletries. And in 1993, it was allocated by the World Health Organization as an acceptable daily intake of, quote, not specified, placing it in the safest category for which a food ingredient could be categorized. Xylitol structure, if you remember your OChem days here, the 5 carbons here are in black, hydrogens are white, and oxygens in red. And again, the 5 carbon that you see here, it makes it a structure that is specific to its ability for inhibiting caries, etc., and for the bacteria not to be able to metabolize it. And we'll talk about that in a little bit more detail. So what is a sugar alcohol? Sugar alcohol gets its name because of its molecular structure. It's a hybrid between a sugar molecule and an alcohol molecule. And they are structurally similar to sugar, sucrose, but they're either poorly digested, as in the case of maltitol, or they're poorly metabolized in the case of erythritol. So 5 hydroxyls again, 5 carbons instead of 6 make it poorly metabolized by bacteria. So when we look at the sugar molecule here, sucrose, what we see on the left is a glucose ring, and what we see on the right is a fructose ring. And when you look at the fructose ring, what you will notice is those purple dots, if you will, the ball and stick. Those purple dots are carbons, and there are 6. I'm sorry, there are 5. Now, that is important to understand because that is how, and we'll talk about this again in more detail, in terms of its mechanism of action, xylitol is able to cross into the cell and develop basically a toxin metabolite, toxic metabolite that will prevent the bacteria, if you will, from thriving. Okay, that's very simplistic, but that is the breakdown. And again, we'll talk about it here in just a little bit more detail. Xylitol's history in organic chemistry goes all the way back to the 1890s when French and German researchers developed it by the sodium amalgam reduction of D-xylose, wood sugar. And sodium amalgam is an alloy of both mercury and sodium. It's a very powerful reducing agent, and it makes sodium safer to handle than on its own because sodium would be quite unstable. Now, originally, when xylitol was first discovered and developed from, let's say, a tree like birch tree, it was a very syrupy, impure mixture. It contained other sugars. In the 1930s, a purification process took place, and during World War II, it was developed into its crystalline form from pure D-xylose. So when we talk about, for instance, the maple tree and maple syrup, I happened to grow up in Pittsburgh, Pennsylvania. In that area of the country, maple sugar is very popular. Maple syrup is very popular. And the maple syrup is tapped from the tree, but in its original form, it is not a pure mixture. There are other sugars in there and sugar alcohols in there as well. So a purification process has to take place so that we can get down to the alternative sweeteners that we desire. Native Americans recognized the antibacterial properties of birchwood, used it to clean their teeth. They made teething rattles for their infants because birchwood contains xylitol, though they didn't know that it was a xylitol at the time. Europeans have, of course, used xylitol for baking, cooking, and as a beverage sweetener since World War II when there was a sugar shortage. And during the 1950s, it was also discovered that xylitol could prevent ear infections in children, and it's been FDA approved since 1963. So here's a historic timeline for you. Again, in the 1800s, Native Americans used birchwood to maintain oral hygiene. 1900s, xylitol was used at first as a diabetic sugar substitute. In the 1940s, it was used as table sugar in Europe because of a sugar shortage during World War II. In the 1950s, doctors took note that children who consumed xylitol had fewer ear infections. The FDA approved xylitol in 1963 for special dietary uses. In 1960s and 70s, research explored the effects of xylitol with amazing results. At an NIH symposium in 2001, the benefits of xylitol were shown scientifically significant by evidence-based evaluation. In 2001, the U.S. military adopted xylitol for its dental prevention program. In 2008, the Arizona State Dental Hygienists Association adopted xylitol as a preventive method for patients, followed by the Hawaii Dental Hygienists Association, who endorsed the use of xylitol for its preventive and therapeutic benefits. Scientists did not realize the biologic properties of xylitol until researchers started to exploit it, mostly because of its insulin-independent nature following World War II. And frontrunners here were Japan, Germany, and the Soviet Union. In Japan, xylitol was used to resuscitate patients from diabetic coma. But it was really the World War II event that propelled the development and research of xylitol. Sugar was the first food to be rationed in the spring of 1942, and this followed the bombing of Pearl Harbor in December 7th, 1941. U.S. imports were cut off from the Philippines. Cargo ships were diverted from Hawaii because these were major exporters of sugarcane. And so the nation's sugar supply was reduced by more than 1/3. And the U.S., in an effort to prevent hoarding and skyrocketing prices, issued through the Office of Price Administration 123 million copies of War Ration Book 1. And these books contained stamps to be able to legally purchase sugar in the United States. So sugar could not be purchased legally unless you submitted these stamps. And this rationing would continue until 1947. And I always say, imagine if we would have had this for toilet paper and PPE at the beginning of the pandemic, right? So this was very demonstrative of the posters that you would see in various facilities during that time with the sugar ration, perhaps in a grocery store and so forth. And an article here from 1942, sugar stamps to be required, and everyone was limited to 12 ounces of sugar weekly. There is the War Ration Book 1 and the stamps that had to be submitted to be able to legally purchase sugar. Now, because the U.S. was a major exporter of sugar, during this rationing period of World War II, there were many countries that just were going to fall through the cracks in terms of not being able to import sugar from the U.S., and one was Finland. So xylitol remained mostly as a research chemical until this war-associated sugar shortage, and Finland forced their engineers and chemists to search for alternative sweeteners. And they knew that these substances were available in hardwood. And so these researchers and engineers at the former Finnish sugar company succeeded to develop an industrial procedure for the small-scale xylitol production. And then production was temporarily halted once World War II was over and the sugar shortage subsided. Now, xylitol has been used since the early 1960s in infusion therapy for post-operative burn and shock patients, in the diet of diabetic patients, and as a sweetener in products aimed at improving oral health. And very famous xylitol studies came out of Finland, and these were the Turku sugar studies, and they were the first xylitol studies with human subjects and demonstrated the relationship between dental plaque and xylitol, as well as the safety and efficacy of xylitol for human consumption. And this was a xylitol sweetened candy that was developed in Finland called susu. And these are small licorice, tar licorice pastilles. And they are named after the Finnish people, which stands for courage, perseverance, and bravery. In 1975, the Finnish company began its first truly large-scale production of xylitol in a small town in the south of Finland called Kotka. And other countries like Switzerland, Russia, and Japan also began production for use in diabetic patients and IV infusion. And the first chewing gum produced by Finland and for dental uses began in 1975 in the US, followed thereafter. So any questions about our timeline and the development of xylitol? And again, for those of you that jumped on here a little late, please be sure that you have accessed the instructions. And we're going to go ahead and repost those in the chat area. It's an orange box. There is a link for you. You will need the instructions so that you can complete the CE credit for this evening. Those of you watching the recording later, please scroll below the video. You'll see a box with instructions, and you can download the handout from there. Okay, so sugar alcohols are commonly found in foods: sorbitol, mannitol, maltitol, xylitol, and so forth. And they come from plant products, fruits, vegetables, berries, etc. And the carbohydrate in these plant products is xylose. And that xylose is altered through a chemical process. Sugar alcohols are most commonly found in food products in your grocery aisle labeled sugar-free. And these include hard candies, cookies, chewing gums, and soda. But they have been recently very popular in health foods, such as protein bars. So this is not an endorsement of any kind. This is to give you just an overall idea of the many, many products that xylitol can be found in. And right now I'm hitting the XYLITOL pretty hard for COVID, and it seems to have been helping, but it's hard to say. I really think xylitol is a very beneficial product to tamper back the bacteria and any type of infection. But we see also Crest White strips, the sugar-free jams, the mints, icebreakers, Nicorette gum, Flintstones gum, and so forth. And following this presentation, if you stay on a few minutes, you're going to learn about ioTech's products as well that contain xylitol. So that's their newer line, very efficacious for dry mouth, lichen planus, a new product for oral mucositis, and so forth. So when I was with the county health department here in Phoenix, I was the chief for the Office of Oral Health. And one of the programs that I developed was the maternal oral health program. So we were able to obtain grant money to purchase some of these xylitol products so that we could dispense them to expectant mothers. Now, the situation, though, is that these products are relatively expensive, and the populations that often need them the most can't afford them. So we were dispensing these through the program when I was with the program a few years ago. However, we're going to find out why these products are so expensive. Again, if you have any questions, please be sure to type them in the chat area. All right, so sugar alcohol has grown in popularity as a sugar replacement in foods such as protein bars because why? They contain fewer calories, they will minimally impact insulin levels, and they're safe for those with diabetes, and they're better for your oral health. Many of the sugar alcohols are considered prebiotics, actually. You've heard of probiotics, symbiotics, postbiotics. Probiotics happens to be a course that I've presented since 2014. Prebiotics are important. Why? Because your gut microbes require nutrition, and prebiotics provide that. So prebiotics are usually resistant starches and otherwise known as non-digestible food ingredients to promote the growth of beneficial microorganisms in the intestines. So here's some of those popular sugar alcohols. And of course, today we're talking about xylitol. We're also going to talk about erythritol and maltitol a little bit. So here we go. Here's maltitol. Maltitol has some great benefits. Its downside is that guy in the middle running to the toilet, all right? It has a laxative effect that can be exerted depending on the quantity and depending on that person's gut microbes. Okay, so their microbiota or microbiome, if you will. Some folks are a little bit more sensitive. But maltitol is great because it has a creamy consistency and it works really well in baked goods. So for someone with diabetes, when they want a sweet treat, it happens to be a good alternative. But again, this laxative effect is a negative. So maltitol has only 2.1 kilocalories per gram compared to 4 for sugar. It's comprised of glucose and sorbitol. It's only 80% of sweetest sugar, has 47% fewer calories, is not carcinogenic, and originally it was processed from cherry, but primarily now from cornstarch. And again, its downside here is its poor absorption. In high doses, it can cause a laxative effect, and for some patients, it may not need to be a high dose. It can get some gas, cramping, and be quite uncomfortable. In protein bars, not a concern at lower levels, so less than 20 grams. If sugar alcohols aren't listed as a separate category on your product label, you can check the ingredients list because sugar alcohols will be one of the first ingredients on that list. So similar molecular weight, creamy consistency, great for baked goods and candies, causes minimal insulin secretion, important for maintaining blood glucose, but it does have this laxative effect. But maltitol also is a prebiotic, so promotes healthy gut bacteria. Now, erythritol, you will see, has 4 carbons and 4 hydroxyl groups, so that makes it a little different than xylitol. And the erythritol sugar alcohol is nearly calorie-free, does not produce a laxative effect, and 70% as sweet as sugar. So why aren't we using it? Well, it is used in foods because it does mimic the physical properties of sucrose or sugar. But it has sort of this aftertaste, a slight cooling effect, similar to mint. So it makes it undesirable in some foods. Now, it does not have the laxative effect, again, as maltitol. It's nearly completely absorbed and excreted intact. So it's not metabolized by the body. The body does not derive energy from this. Therefore, there are no calories. Erythritol sources come through fermentation. And after that fermentation, the erythritol is filtered. It's dried into crystals. Erythritol is found in a variety of fruits, such as grapes, pears, mushrooms, certain fermented foods, such as soy sauce and wine. And if you went to Amazon today, you would see erythritol like this. And again, it's in a bag, and notice it says 100% pure, non-GMO, sugar-free, 0 calories, low glycemic impact. And here is a bag of xylitol, and the same. Now notice on this label, when we're looking for where it lists the sugar alcohol, they have it here listed under total carbohydrates. And also notice, and we're going to revisit this here, that diarrhea may occur with excessive consumption of xylitol. If this happens, reduce the intake or discontinue use. And again, because it is a prebiotic, it's not necessarily an excessive consumption. Sometimes your patient will have to start off at a lower consumption rate and then slowly ramp it up to allow their gut to acclimate. Notice the warning also, which we will revisit at the end of the presentation. Xylitol is safe for people. It's harmful and even fatal to dogs. So make sure that your patients understand they need to keep it out of the hands of your pets. I was in a vet emergency hospital a few months ago with my little dog, and someone came rushing in with a Cocker Spaniel that got into xylitol sweetened strawberry jello, and they called poison control, and that is considered a life-threatening emergency. So the vet they stopped what they were doing, took the dog back right away. Sometimes they have to administer dialysis, and they determined that the amount of xylitol in that little amount that the dog had was not going to be toxic to the dog. And what happens is that the animals completely empty their insulin store. Okay, so Katie, I believe it is. So yes. Okay. The xylitol's mechanism for action, cavities, we know they're caused by cariogenic bacteria, and tooth demineralization over time may cause a cavity to form. And when we talk about the acid produced by bacteria when substrate is present, like sugar, for instance, we're talking about glycolysis. So the glycolic pathway here is the main energy producing pathway of the bacteria. Okay, so we know that bacteria aggregate in dental plaque on the surfaces of the teeth, converting glucose, fructose, sucrose into these acids, again, through glycolysis. And over time, when the acids are produced, especially when they remain on the tooth structure, the pH in the immediate environment of the tooth can decrease quite rapidly, making the saliva and the interbacterial fluid in the dental plaque more acidic. And some bacteria we know are xylitol sensitive, so they're unable to metabolize xylitol. They essentially starve, and we're going to take a look at how that happens. So demineralization, as we said, takes place when a tooth surface is exposed to the acidic metabolites over time. And some strains of these bacteria are unable to metabolize xylitol, and this reduces the favorable conditions for tooth demineralization, and it helps to increase favorable conditions for tooth remineralization. And the environment becomes altered by xylitol. So cariogenic bacteria thrive best when they are living in an acidic house, okay, in plaque, acidic saliva. Cariogenic bacteria cannot effectively metabolize xylitol. Fewer acidic metabolites are produced. The dental plaque is altered. There's less acidity. It becomes a less favorable environment for the bacteria to thrive. So the xylitol starvation effect, okay? Now, how does that happen on a cellular level? Well, when xylitol, which we said is a 5-carbon sugar alcohol, is available to cariogenic bacteria, it's transported across the bacteria's cell wall via an uptake system that's really intended for fructose. Remember, it's also 5-carbon sugar. So it mimics that of sucrose or fructose, excuse me. And during that process, the xylitol, as it's pumped across the cell wall, is transformed into xylitol phosphate, which is a compound that these bacteria cannot metabolize. So essentially the bacteria starve because the Non-metabolized xylitol phosphate will accumulate to toxic levels within the bacteria, interfering with metabolic pathways that they require for nourishment. And regular exposure of the oral cavity to xylitol creates a situation where carcinogenic bacteria tend to become starved, or at the extreme they die, and the growth and the well-being of the colonies of carcinogenic bacteria become impaired. So we see overall decreased number of carcinogenic bacteria in plaque and decreased acidic metabolites. But we also know, like other bacteria, that these bacteria can become resistant to xylitol. But in this case, xylitol resistance promotes less virulent strains of bacteria. Let's take a look at that. So in a background here, a person's long-term exposure to xylitol will tend to affect the population size of various types of carcinogenic bacteria that live in their mouth. And within that population, there are some mutations that occur, right? Bacteria divide very rapidly by binary fission, and they will produce these mutations now and then. When the mutations are in the right environment, they overtake the population. So in this case, the mutation may be a genetically altered fructose uptake system. So this is one that the bacteria is unable to transport the xylitol. And because of this, the bacteria will not accumulate the toxic levels of xylitol phosphate. So there is a population shift that occurs. The xylitol-resistant bacteria continue to thrive. Their xylitol-sensitive counterparts will not. And over time, the numbers of sensitive bacteria will decrease, and the numbers of resistant ones will grow and ultimately predominate. And research suggests that xylitol-resistant strains of carcinogenic bacteria are less virulent. They're less capable of causing tooth decay than their counterparts. And why is that? Well, one theory suggests that the xylitol-resistant bacteria have impaired adhesive properties. For the bacteria to do the damage by producing the acidic metabolites, they have to be able to aggregate, and they have to be able to adhere to the tooth structure, right? So it's thought that these xylitol-resistant bacteria have impaired adhesive properties. Due to this fact, they have less ability to create ideal conditions for tooth demineralization and therefore less tooth decay. Any questions or comments about mechanism of action? So is this only carcinogenic or cariogenic bacteria? I'm assuming are also good natural oral bacteria. It is specific to cariogenic bacteria, so strep mutans, but also you'll see that it's specific to Haemophilus influenza and other pathogens that we would like to not have around. Okay, so xylitol is a polyol, as we said. It's a polyol sugar alcohol, often referred to as birch sugar because it can be produced from the birch tree, either the bark or the pulp. There are other natural sources of xylitol: fruits, plants, plums, strawberries, raspberries, rowan berries, and even the human body produces xylitol. Xylitol is manufactured from plant materials that are rich in xylem, which is a natural polysaccharide that consists of those xylose units, right? And xylitol occurs freely in nature. It may be more economical to produce from specific plant parts. However, the birchwood tree is not that economical because you have to basically cut down a tree to produce it. So you're reharvesting trees. Corn cobs we'll be talking about today. However, we'll see the production of xylitol is still quite costly, and much of it is done overseas. So xylitol is a byproduct, as we said, of human metabolism. It is the normal metabolic intermediate of the glucuronate xylulose cycle, and there's the diagram for you. You don't need to remember that, but you may want to remember that the human body produces it. Okay, so corn cob source here. Corn cobs are subjected to a process that I'm going to show you here called biomass hydrolysis. And the corn cob uses a natural ion exchange interaction of hydrogen, hydrochloric acid or sulfuric acid, and steam. And that wastewater is often produced, can be used for mushroom farming in the case of hydrochloric acid. For sulfuric acid, not, it's considered toxic. The pulp can also be used for fuel. As we're going to see in the next diagram here, that there's quite a bit of biomass waste that is produced from xylitol production, and that is a problem here in the US because manufacturers will be subjected to high fees for storing biomass. It has to be stored somewhere in a landfill somewhere that's been approved for that. So many of these companies will take the manufacturing overseas, like China, where they don't care as much about the environment. I think China is starting to change their ways, but you can see that what will occur, the biomass is introduced. In this case, it is the corn cob. It is subjected to acidic hydrolysis or sulfuric acid, and 90% off the top is biomass waste. 10% is the actual sugar liqueur, and then there is a multi-step purification that takes place where there is more wastewater that is extracted down to the xylose units, and then of course more purification and dehydration to its crystalline form of xylitol. That's it in a nutshell. Corn cobs have a very high xylose content, 25%, and they are everywhere in the Midwest in the US, right? So you drive by silos and so forth. They're considered renewable. But again, much of this is sent overseas. This was a Chinese study using corn cobs and the reduction of environmental impact, where they were able to create ethanol from the biomass. So they are looking at the environmental impact in China. And again, the production of xylitol is highly, it's a high pollutant for the environment. Okay, after those corn cobs then are subjected to the acid hydrolysis, you'll see further processing that occurs, purification, filtration. The xylose, as we said, is converted to xylitol, and then you end up with the xylitol crystallization. Any questions about the manufacturing of xylitol? Okay. So we know since World War I, the public sugar consumption has continued to creep upward. It now exceeds 120 pounds per year, which sounds incredible. When I was a child, it was very common to have a bowl of sugar on your table. It's called table sugar. Sprinkled it on your cereal, sprinkled it in your Kool-Aid, you sprinkled it on your sweetened cereal. I mean, it was like one of your 5 essential food groups growing up, right? You don't see that anymore. Now, we also know, though, that much of our diet here in the West is highly processed, and it contains a lot of hidden sugars, quite a bit. So highlighting the negative health concerns from excessive sugar consumption concerning, for instance, diabetes, oral health issues, public health has initiated several different policies. You know, every summer here we tried launching the soda-free summers. Of course, many of the dental associations will have the buy back the candy program and so forth. It's always questionable to me if that is really a long-term solution. However, those are some of the policies or public health initiatives that occur. And communities have attempted to restrict the sale of sugar and soda beverages in public schools. So this is just a breakdown of the kilocalories of xylitol, 4 kilocalories per gram. Similar to other dietary carbohydrates, its practical caloric value is 2.3 kilocalories because the FDA permits that on labels because of the slower caloric utilization, because we incompletely absorb xylitol as humans. And we discussed xylitol's mechanism of action, but in terms of caries prevention, accumulated evidence suggests that mutans streptococci are the target organisms of xylitol in vivo. Reduced remain at lower levels even during long-term xylitol consumption, but that consumption needs to continue. Once we stop consuming, the protective effect, if you will, stops, right? So you have to consume it to be able to continue the effects of its anti-cariogenic effects, if you will. Xylitol consumption reduces the accumulation of plaque. It's consumed by mothers, and it can reduce the mother-to-child transmission of mutans streptococci, and therefore caries occurrence in their infants and children, and xylitol consumption reduces the risk of caries in children. Research reveals that xylitol can reduce the mother-to-child transmission of mutans streptococci, which we know is the bacterial disease that causes dental decay. And this was a study here where they looked at the effectiveness of mothers chewing xylitol gum beginning in the 3rd to 5th months of pregnancy for reducing the mother-to-child transmission of MS. And what the trial confirmed was that xylitol chewing gum during pregnancy is an effective early intervention for reducing this transmission. We do know that to effectively prevent caries, a patient needs to take xylitol on an ongoing basis. And compliance, therefore, does play a major contributing factor for xylitol efficacy. So in this study, you may see this on a quiz, the investigators reported that the children whose mothers did not chew xylitol gum acquired mutans streptococci inoculation 8.8 months earlier than did those whose mothers that did chew the gum. All right. So the results from this trial revealed that maternal exposure to xylitol chewing gum provided intervention by preventing or delaying the mother-to-child MS transmission. Expectant mothers will need to chew the gum, though, 3 to 5 times a day. So again, compliance plays a major role. It's important to start at a subtherapeutic dose for a week to avoid that risk of laxative effect, if you will, and then they can increase their dose until the desired amount. And we know that xylitol is available in mints and chewing gum. Not all patients want to chew gum, so mints can be used, but they should allow the mint to fully dissolve over about 5 minutes. The American Academy of Pediatric Dentistry back in 2015 had a statement paper about xylitol, and here were some of the concerns. They believed that the chewing gum studies were, the results were confounding, meaning that just chewing gum alone is going to cause saliva to be secreted, therefore increasing the pH, acting as a buffer, right? So that could possibly interfere with the results. They also believed that the amounts were concerning. Some of the children developed osmotic diarrhea, as we said, abdominal distress. And using xylitol 4 to 5 times a day, the frequency may be unrealistic in clinical practice. If you've ever had a toddler trying to chase them around to give them medicine twice a day can be a challenge, but 4 to 5 times a day, not realistic. And the delivery methods, we're certainly not going to give a toddler chewing gum. But the AAPD did support quite a bit of xylitol's research in terms of further research to clarify the impact of xylitol delivery vehicles, the frequency of exposure, and the optimal dosage to reduce caries and improve the oral health of children. If you ever had a toddler, you know that there's a certain age that they can get where they may develop ongoing ear infections. Sometimes it overlaps with teething. They're tugging on the ears. And xylitol has been shown to be very efficacious in those situations. But why are infants more prone to middle ear infections? Well, they're horizontal. The jaws have not fully developed. The dentition has not erupted. And therefore, the eustachian tube is shortened and horizontal. And when they develop any sort of little cold, it can very quickly affect this middle ear, the vestibular area, etc., and develop an infection. It's a very difficult space to treat, so they can get ongoing infections. As we become older, more mature, the jaws develop, teeth erupt, this eustachian tube becomes elongated and more vertical, and hopefully we're not afflicted with the ear infections we may have had when we were 14 months old. This was a Cochrane review, 4 studies from Finland. It was a meta-analysis that showed that healthy children can reduce the risk of acute otitis media by using 2 pieces of xylitol chewing gum 5 times a day. Now, that's a problem if you are this patient, because this patient isn't chewing gum anytime soon, right? So how do we get the xylitol to the little people and be able to prevent these ear infections? So these were more clinical trials to look at using xylitol in the management of otitis media. And this was Connie Akari, who is a very famous researcher in Finland, I believe. And they looked at using xylitol chewing gum or syrup in daycare center subjects. And it was associated with a reduced rate of acute otitis media with a lowered nasopharyngeal carriage rate of pneumococci. So in 2 clinical trials, xylitol was found efficient to prevent the development of acute otitis media with a daily dose of 8.4 to 10 grams of xylitol given in 5 divided doses. So again, you're looking at waking up a 14-month-old twice through the night to be able to administer it. And they looked at, again, both chewing gum and syrup, and they found that they still had efficacy, the 2 to 3 months follow-up trials, approximately 40% when chewing gum was used and 30% with xylitol. This is another very famous researcher, again in Finland, Dr. Matti Ahari. His group reported their findings. They showed that ear infections in children could be reduced by up to 40% with 8 to 9 grams of oral xylitol delivered every day. This was another controlled double-blind clinical trial. They found that they could reduce mutant streptococci in plaque by administering 6.88 to 10.32 grams per day. What they noted in this study was a plateau effect. So more is not always better, and it's expensive, right? So it's good to know what that dosage should be. All right, xylitol syrup, we're going to look at this study. And xylitol syrup is available by some distributors. If you're familiar with Dr. Ray Wagner here in Tucson, Arizona, and he is the creator of Spiffy's. His company also has created a syrup, and they've studied it quite extensively. So xylitol syrup administered in children, what they looked at here, Milgram et al. Conducted a double-blind randomized controlled trial using a xylitol topical syrup to determine the effectiveness in children in xylitol oral syrup administered as little as twice daily at a total daily dose of 8 grams was found to be effective in preventing childhood caries. And you're going to see that on a quiz. So instead of 4 to 5 times administered, this was twice a day consumption, which is safer in a syrup form. And they believe this sort of disputed the AAPD's concern about the confounding factor with chewing gum. I'm going back here to, there's a question here, are there studies to see how effective xylitol is for decay in adults? Yes, that is this slide, number 100. One of the studies, there are many, many. Turku, the Turku Finnish studies that we spoke of earlier is a very famous human clinical trial study. So again, with only 2 applications of xylitol syrup required per day, for effectiveness, compliance, of course, is easier to accomplish, and thereby we can increase the therapeutic effect and caries prevention. And there are several studies here that I'm going to just breeze through here. The xylitol gummy bear study is here for you. This is a very large study, and they, if you've ever had to administer oral health prevention programs for children, which I administered 3 of the largest in the US for quite some time, they are expensive studies. I could have gone out and bought insurance premiums for each one of those children and sent them to private practice in Scottsdale for what we were paying through the health department to administer fluoride varnish and dental sealants. So if there was a way that we could administer, let's say, gummy bears in school and reduce the level of decay, wouldn't that be great? It would be much more cost effective. Here in the US, though, the concern, of course, is choking and so forth. But here are the results. And they showed after 6 weeks of consuming xylitol gummy bears, the level of mutant streptococci and Sobrina streptococci were significantly reduced compared to the baseline levels. We also need to be concerned about dry mouth. And it is the #1 growing oral health condition in the US. Many older people will develop xerostomia because of multiple medications, or not. You may not be an older adult. You may happen to be on medication that it does cause dry mouth on a temporary basis. And what can we use to address that? And really, there are so many great over-the-counter products with xylitol to use. And any of these novel topical dry mouth products, this was a study, there were results that showed that they could significantly increase unstimulated whole salivary flow rates with xylitol, reduce the complaints of dry mouth, and improve xerostomia-associated quality of life. So again, over 400 medications known to cause xerostomia, and xylitol products are particularly useful in treating the symptoms of dry mouth, reducing the incidence of root caries, which can be catastrophic, right? And restoring balance and harmony to the oral tissues. Ventilator-associated pneumonia is a huge, huge major challenge in the care of critically ill patients. And this was an NIH grant where they looked at aerosolization of xylitol to treat these VAP patients, okay? Some fluoride varnish contains xylitol. I'll leave it there. I just used fluoride varnish that was given to me at the county health department and others. But some show that there's greater efficacy. Many of these are driven by sponsorships. So you have to take a look at the data and understand if you believe it's biased or not. Erythritol versus xylitol. So this was a study that showed that erythritol happened to be more efficacious in this particular study than xylitol. Okay, very quickly, I'm going to talk to you about the efficacy of xylitol combined with molecular iodine and the studies that demonstrate superior efficacy. And it has been shown that the xylitol in combination with molecular iodine rinse was far more effective than any other rinse tested. It was the only rinse to completely inactivate periodontal pathogens, and testing was conducted at a 30-second exposure in the presence of whole human saliva, and that's important. It has to be in the presence of whole human saliva. So what about molecular iodine and xylitol combined as an antiseptic rinse, what we see versus periodontal bacteria? Complete inactivation of Fusobacterium nucleatum, complete inactivation of Prevotella. If you drop down here, you see chlorhexidine gluconate, 20 times less effective and 700 times less effective. Cetylpyridinium chloride, 800,000 times less effective. Chlorine dioxide, 290,000 times less effective. Povidone iodine, 20,000 times less effective. Hydrogen peroxide, which is almost useless, 600,000 times less effective, and so forth. And all of these tests were conducted in the presence of fresh human whole saliva at a laboratory in Concord, California. Here's another diagram we're going to show you. Xylitol molecular iodine rinse, completely effective in 30 seconds against, again, periodontal bacteria, carcinogenic bacteria, upper respiratory viruses that include SARS-CoV-2. In the same frame time, chlorhexidine gluconate, which is a poor antiviral, is only partially effective. So you see complete inactivation of Prevotella, Fusobacterium, mutans streptococci, rhinovirus, and SARS-CoV-2. For xylitol combination molecular iodine with chlorhexidine gluconate, poor antiviral, over 1 million times less effective in inactivating strep mutans, for instance, and 600 times less effective in SARS-CoV-2. The xylitol molecular iodine rinse was completely effective against SARS-CoV-2 within 30 seconds. Antiviral pre-rinses that were recommended by the ADA in their interim guidance, which included hydrogen peroxide, povidone iodine, as well as chlorhexidine gluconate, were not completely effective, not even at 60 seconds. And Canada removed hydrogen peroxide from their guidance because it's useless. Here's the antiviral efficacy against SARS-CoV-2. Let the results speak for themselves here. We see complete inactivation at 30 seconds, 60 seconds, and observed cytotoxicity was none for xylitol molecular iodine. Clinicians report evaluated antiseptic oral rinses for the efficacy against SARS-CoV-2. The only rinse they found to be effective in the presence of saliva was the xylitol molecular iodine rinse, and this is what is going to be presented after this course today by ioTech. Okay, so the xylitol molecular rinse combination, molecular iodine rinse combination is the only rinse that clinicians report now recommends as an antiviral rinse. At 100 parts per million, molecular iodine showed a 275 times greater virus reduction compared to 0.2% povidone iodine. 100 parts per million molecular iodine was the only product to be shown effective in the presence of saliva, and laboratory testing without saliva does not provide realistic information. In closing here, xylitol and other sugar alcohols may be harmful or fatal if ingested by your pet, and advise your patients of that. Keep the xylitol products away from pets, the mints, whatever they happen to be using. And also please be advised that some of the peanut butter and the nut butters now may contain xylitol. Even the products that you've used for a long time, they may have started adding xylitol to them. So we've provided you with some links here. This is the 24/7 Animal Poison Control Center and their website, and you may want to share that with your patients. These are more resources for you. So Dr. Moskowitz, who is the chairman of ioTech International, presents a course on our website live every month called Oral Rinses, What's Safe, What's Effective. It's offered also on demand. You can watch it tonight if you want. There's the link to those courses. Treating periodontal disease in the post-antibiotic age. We also offer a course in xerostomia and antimicrobial resistance. And let me take a look at your questions here. Carly would like to know, is there a product rinse with those combined molecular iodine and xylitol? And yes, if you care to stay on for a few minutes, we have Jason Garris from ioTech International, and he will be discussing those products with you and their brand ambassador program. Thank you, everybody. So molecular iodine, you're going to hear a brief video about. If you stay on for a few minutes, I'm going to go ahead and bring that video up. Again, for those of you that may have joined us a little late, please be sure that you have the instructions. They're in the handout, includes the slide. I'm going to go ahead and bring up ioTech's presentation here. And this is going to be presented by Jason Garris. But, and this is also in your handout, I'm going to show you a quick video from Dr. Moskowitz.
You're already aware that xylitol offers multiple benefits when incorporated into oral care products. A key benefit is that xylitol is not metabolized by cariogenic bacteria. But xylitol's benefits are magnified many times over when combined with molecular iodine. As an example, ioRinse Ultra, a patented, non-staining xylitol molecular iodine oral rinse, is far more effective in inactivating periodontal pathogens than either chlorhexidine gluconate, povidone iodine, chlorine dioxide, stabilized chlorine dioxide, cetylpyridinium chloride, or hydrogen peroxide. The table shown provides the results of rigorous testing in the presence of saliva. The testing compared the biocidal efficacy of 7 different antiseptic rinses with a 30-second exposure to 2 prominent periodontal pathogens, Fusobacterium nucleatum and Prevotella intermedia. A key finding was that the xylitol molecular iodine rinse, ioRinse Ultra, shown in the top row, completely inactivated both pathogens and was the only rinse able to do so. The next most effective rinse was chlorhexidine gluconate, but its effectiveness was limited, ranging from being 20 times less effective to 700 times less effective than ioRinse Ultra. The other rinses were tens of thousands of times less effective, hundreds of thousands of times less effective, or not effective at all. The take-home message is that no oral rinse is as safe and effective as ioRinse Ultra. If you like xylitol, you and your patients are going to love ioRinse Ultra.
Okay, everyone. Well, I'm excited to be able to introduce to you Jason Garris. He is the Vice President of Global Sales for ioTech International, a world leader in molecular iodine research and development. He previously founded and served as CEO of Garris Associates, a pioneer in guerrilla social media tactics. During his tenure, he personally trained thousands of sales professionals and hundreds of management teams on 3 continents in cutting-edge social media strategies. And we are going to add their information at the top of the screen for you as well. So welcome, Jason. And I do want to give a shout out to ioTech for supporting this course, and to everybody here on this program that has listened to me hack my way and clear my throat through this presentation. So thank you, Jason.
Kirsten, I hope you feel better. I hope hope you get through this. Again, I want to thank everybody for coming tonight and watching the course. This course was about xylitol and its benefits. And as the global sales director for ioTech International, I'm so proud to let you guys all know that when it comes to xylitol, uh, iodine iodine products do have xylitol in it, and we'll get into that in a second here. Again, so um, many of you, if you don't know who I am, I'm Jason Garris, Global Sales Director for ioTech International. Founded back in 2013, we started research and development on trying to take high levels of molecular iodine and make it stable. So when you think about iodine, you think of there's many species of iodine in what we call povidone iodine. So povidone iodine is 31,600 parts per million of total iodine, but only 3 parts per million kills germs. And you think to yourself, oh my God, what is the 31,597 parts per million? What's it doing? Well, it contributes to staining and toxicity. And so by taking the levels of molecular iodine and increasing them and taking that molecular iodine and boosting it up and suppressing the other forms of iodine, it is a wonderful has wonderful benefits, because now what we did was we took povidone iodine and we made it actually 40 to 100 times stronger than what they would use as a gold standard of care, and they've been using that since the 50s. So that said, when you look off to the far left, you'll see iorinse ready to use, which is a molecular iodine uh, rinse, and it does have xylitol in it, and it's a soft mint flavored. It is a wonderful rinse. We have in the middle, we have the iorinse concentrate, high levels of molecular iodine, which then you could use that for scaling and root planting, for irrigation. And also, what's wonderful about that is you take that product and you add it to a water pick, and it's amazing, because when you're water flossing and you take one capful and you put that into a water flosser, that iodine is running through your gums, and you're water picking away, and it's fabulous, especially with a pickpocket tip, because it gets 90% down into the pockets. We have IO Cleanse, which is a hand cleanser. We have a nasal barrier cream, which has high levels of molecular iodine in it. We do have a saline mist spray, which is a nasal spray with molecular iodine, also, which is really fabulous. Many of you guys heard of Perio Protect Tray. They use a gel. They use the hydrogen peroxide. Um, our gel is the molecular iodine gel and has xylitol in it. And so the gel, when somebody has severe perio, they with a soft EVA tray or Perio Protect tray, they can take this. They fill the tray up, and it's wonderful for severe perio. Patients wear that for no longer than 10 minutes per day, and it is wonderful for periodontal disease. What's really exciting is that we do have a pet water additive that we have, and that pet water additive is wonderful for dogs and cats. You would be able to add the product to your pet's drinking water. And what's fabulous about this is you would just take a little bit of this molecular iodine and put it in the pet's drinking water, and it helps to keep the plaque off the teeth, as well as it is wonderful for periodontal health. And the nice thing about it is molecular iodine is an essential nutrient, and it's safe to use. And what I really love about our products, unlike chlorhexidine is a carcinogen. It is, if you look under the material safety data sheet, stay focused on what you're actually rinsing out with, because what we're trying to do is trying to educate people on why to use our products, and we're talking about safety, and we're talking about health benefits, and chlorhexidine is the opposite. It can only be used for 10 days. It inhibits fibroblasts. It can't be used long term. It has bacterial resistance. It's something that only can be used for 10 days. So what can you use long term for a long term problem? And what can you use every day? And that's what patients are looking for. So this is a wonderful at home rinse. And this is our product that you don't see there. It's called ioRinse Ultra. This is our new over-the-counter drug, OTC drug, and it does not need a prescription. But dental offices would sell this in their practice, and the patients would go home with our ioRinse. The beautiful part about this is that this is so much more powerful than chlorhexidine. It actually blows it away. One is it's safe, can be used daily. It's wonderful. It has healing benefits. It has so many benefits. And the greatest thing about this also is that there is xylitol as well in this as well. And so using this daily ioRinse Ultra is a wonderful daily rinse, and it's no staining, no toxicity, and no alcohol in it. So somebody that is a recovering alcoholic can use it. Young kids can use it under supervision. So it is a wonderful rinse, and I encourage everybody that if you see the tap here button, to please hit the tap here button and inquire and reach out to me, because I would like to do a lunch and learn with your practice. And in that lunch and learn, I will send $100 gift card that you'll be able to use to purchase for lunch. Also for the hygienists that are on here, or any of the dentists, they could use that for themselves. But the idea is introducing this to the practice, because it is a wonderful item to stock and sell in your practice. So we do have a brand ambassador program, and I'm not really going to get too much into the brand ambassador program really tonight. It really is about when a patient leaves the office, that you, as a hygienist or a dentist, can actually make a little bit of money off of each bottle that you sell to your patients. Now, obviously, if you stocked it in your office and you bought it for $13 a bottle, you would sell it for nearly $40 a bottle. So wonderful profit. And the beautiful part is it keeps your patients coming back in monthly, because this will last a month. And then what will happen is they'll have to come back in every month to get a new bottle. And the idea is that brushing and rinsing is actually more effective than brushing and flossing. And so many of you guys will question that. And again, hit the tap here button, and I will send you the article on that, because this has antimicrobial properties in it. So, when you're talking about getting rid of bacteria, flossing does not get rid of bacteria. So it does to a certain degree, but we're talking about, reducing the amount of bacteria in a substantial way. So that said is, unlike hydrogen peroxide as well, this is also better than hydrogen peroxide for tissue healing as well. That said, if you wanted to in your dental office recommend this to the patient, you would just, ask them, Mrs. Jones, go to the website, order it. They order it. When they order it, you get paid on every bottle. You get 10% commissions on every bottle. If it's $40 a bottle, you're making $4 a bottle. But when you're making $4 a bottle and you have 100 patients, well, in a month's time, you have $400 coming in a month. And the nice thing is, when they come in or every month, it's a wonderful revenue stream for your office. That said, we also have it where when you bring on other hygienists, other people, other friends, and whatever they do in business, we will, for every $1,000, we will give you $100 for every 1,000 they do up to 15,000. So it's $1,500 commission for you if they hit 15,000 in sales. We give that as a bonus. This is not multi-level marketing. It is a strict bonus. It's a tier. We want to give you as much as we can, and we're just trying to be very fair about it as well, because we encourage people to use it, and we also understand that it's your time, and anything helps. That said, as a brand ambassador as well, many of you are friends with your, dentists that are friends of yours. You have other hygienists that are friends of yours, and they all work in different dental offices. If you get us into a dental office, I'm willing to give you 10% of the sales. Now, I'll give you an example. If a dental office buys 10 cases a month, and 10 cases is, let's just say it was $1,600, then I would have to give you a $160 check for signing up that dental office. Now, doesn't seem like much, but if the average dental office does $12,000 a year, and you get 5 dental offices, that's 60,000. Well, which means that 10% of that a year is another $6,000 a year income, which is about $500 a month. Does not seem like a much, but I will say that you're in business to give the patient the best patient treatment outcome. What are they going to do when they go home with bleeding gums? What are they going to do when they go home with these problems that are forever? Chlorhexidine is a 10-day fix. What are you going to give them that's better than iorinse Ultra? And I promise you, there is no product out there today that is more effective than iorinse Ultra. And when you look this up and read about it and take the CE class, and actually Dental CE Academy does have a class with Dr. Herb Moskowitz talking about the iorinse and what it does and how effective it is, and about rinses in general, and what to look out for and what not to look out for. So important for you to know, what are you putting in your patient's mouth? What is the results, and what are you expecting the results to be? And if you can't give an answer on that, that's when you should take the class, because it's truly amazing. Canker sores. You could read on Amazon the reviews and what people have to say about this. We do have a rinse coming out. We're so excited about this. It's called iorinse MR. And iorinse MR stands for iorinse maximum relief. And what's really exciting about this is that iorinse MR is glycerin at 4.5%, which is what oncologists use for oral mucositis sores, for sores in the mouth. 4.5% glycerin, but 4.5% glycerin, and adding 100 parts per million of molecular iodine and xylitol to it. It has so many benefits, and what it does for cancer patients when they get the chemotherapy and they get radiation. 40% of those patients, 40% of chemo, will wind up with the sores, and almost 90 to 100%, if you get radiation, you will be getting sores in your mouth. And those sores are so painful that if you take that canker sore and you can multiply that, it's so painful. And anybody that's suffering from chemo or radiation shouldn't have to deal with that. And when they shouldn't have to deal with it, that's why iorinse MR is all about. But beautiful part is, iorinse MR could be used as a mouth rinse in general as well, because it has glycerin, which is great for dry mouth, and the glycerin is great for the. So when you again, I'll be able to send everybody information about that as well. Also, while we're on here tonight, anybody has any friends or anybody that has cancer that is going through chemo and radiation right now, please again hit the contact button, because if they have chemo and radiation and they have mouth sores, I will send a free bottle of the iorinse MR to them, and I will also pay for shipping. I will show you, and I will show that patient that I will be able to help them get through their chemo and radiation in the best way I can, and Sores on top of radiation is not something that a cancer patient wants. And that's what it's all about. So best patient treatment outcome with ioRinse products. And guess what's really wonderful about it? It's safe, it's all natural, it's organic. Other than ioRinse Ultra, because ioRinse Ultra does have cetopyridinium chloride in it, and that is not organic. That said, if all of you guys would like to again learn more about our products, please again hit the contact tap here button. Ask me any questions. When you take all those three things as a brand ambassador, if you get some dental office, you get some professionals, you bring some patients on, minimum you could make is another 20 grand a year. And of course, you can make 100 grand a year if you're one of those go-getters. Now, we do have exciting things going on. I tell you, with our brand ambassador program, I can show you, which is really exciting. This is what happens is I get notified that when a order does come in. And what's really exciting is it tells me who put the order in, and it tells me how much they got in. So if you look over here, here's an order for $332 by a brand ambassador today. Well, I mean, that brand ambassador is going to make $33 today, and guess what? And it's part of their daily routine. Their job is to educate patients what to do when they go home. Their job is to also let their dentist know what is out, what is new, what's exciting. I will tell you that chlorhexadine's been around since 1955 in the 70s. And we've been using it since the 70s. We are now in 2023. And if we didn't change, we wouldn't be where we are today. And that's the beauty about innovation, is changing. And I tell you what I mean by that is, if we were all using the phones that we had before the smartphone, and everyone said, I'm not going to use a smartphone. I hate smartphone. I would never use it. Well, now look at people. You can't live without it. And that's the same thing with ioRinse, and that's coming. That's our newest product, is ioRinse Ultra. Again, strongest, safest product in the world today, used in dental offices, replacing chlorhexidine, and no more, and can be used every single day, and it is wonderful to use. Again, you can see the price of our products. What I was willing to do, if you become a brand ambassador, I'm going to send you all of our products. I'm not going to charge you at all. I'm going to send you a whole kit. I'm going to send it right to you, and you're not going to pay a dime. If you become a brand ambassador, what I do is I don't charge you for actually 1 month. In other words, when I do charge you, I'm only going to charge you $69 for the kit. I'm not charging you any more than that. That would retail $320 if I was to charge you. I'm not looking into business of making money on kits. I just want to send you all of this so you have a sample of every single one of our products and the benefits of our products. If you look here, if you take your phone and take a picture of this, there is my email. There's actually brand ambassador support. There's my cell phone number direct. If you want to call me, please do. You can scan the QR code. Also, again, hit the tap there now button, and please also learn about our products. I will show you one last thing before we get off today, which is really super exciting. When you think of using our rinses, and you're a hygienist, your job is to look in the patient's mouth and see what's going on. And what I really love about this is, the other day I was looking online on ioRinse, and I come across a picture of a couple tongues here, and one side shows this white tongue, and this guy complains to write the whole story. He's been trying to get rid of this white tongue for years, and doctors have recommended different products, and he's tried everything. Well, when I scroll down and I look to find out that he ordered ioRinse Green Apple, and what he did was he used it, And in one day, his tongue, all that gook and slime and bacteria got off his tongue. And since then, he's been using the iorinse green apple, which is not with xylitol. Actually, the green apple is with saccharin. But this particular bottle is what he's using, and the gook just came off of the tongue. We have bacteria in our mouth. Our tongue collects it, and it is so important to keep our mouth clean, and that's what these iorinse Ultra does in the best way possible. And again, please, all of you hit the tap here. My uncle, Dr. Herb Moskowitz, does have a class, CE class on molecular iodine. Please take that class. All of you want to become a brand ambassador, please do. Again, I will send you a kit. Also, any of you that would like to do a lunch and learn with your practice, again, I will send you a $100 gift card as long as everybody's there and you guys can pay for lunch, and I would be glad to entertain you and teach you of why you should be switching and using our products. And it is a wonderful new profit center for your dental practice. And thank you very much, Kirsten. I hope that you do feel better, Kirsten.
Thank you, Jason.
Yep.
I have wanted to remind everybody a couple of things. In their course folder, they have a copy of your slide deck. They have a copy of our slide deck for the CE portion. In there is a link to the oral rinses course, which is live and on demand. And I did mention that during the presentation, but it's really an excellent program. It's an hour and a half, and Dr. Moskowitz will review the literature for every antimicrobial rinse known to man, basically. I mean, all of the details that you need to know. So it's quite enlightening. I think you're going to actually be shocked by some of the information that you see, because some of these chemistries that you've been using for years and years are quite frankly useless. They're quite frankly useless. They have poor antiviral efficacy, especially in the presence of whole saliva. Let's see if you have some questions here. There was a question about beneficial for pre-surgery. And I'll go ahead. Yep. So pre-procedural rinse, excellent pre-procedural rinse as well. Can it be used in place of chlorhexidine post-surgery? Absolutely. You don't want to use chlorhexidine post-surgery.
Nope.
No. Any other questions for Jason? And again, please be sure to refer to the handout. If you tap on the banner at the top of the screen, you can bookmark that if you want to take it back to your practice tomorrow. You can save it to your phone or your laptop, and then you can take the information back to you. And if you want to set up the lunch and learn, of course, you're probably going to need to coordinate that with your practice associates and so forth.
And Kirsten, I will say as well, and I'm going to send you a bottle immediately, Kirsten, as soon as we get off this phone. This is the iorinse ENT. And iorinse ENT, this bottle is molecular iodine. And what I really love about this is that when you take the iorinse ENT and you use it in the NeoMed bottle, what you do is you use the distilled water, and you still use this little saline packet that comes with the NeoMed.
Right.
So you mix the NeoMed saline packet, you put one capful of the iodine into the NeoMed bottle, you fill it up to the line, you shake it, and now you're able to rinse your sinuses out. And many of you guys that have sinus issues or allergies, it's a great sinus wash. As well as using the molecular iodine saline mist spray, because here it contains a few parts per million of the molecular iodine as well as the saline. So any of you people that we're going into allergy season, it is a wonderful wash. And the molecular iodine has wonderful benefits, and learning about the iodine it's going to be extremely beneficial. And just remember that molecular iodine is what does all of the germ killing. saying povidone iodine. Our job, our patent was taking that molecular iodine and taking all the other iodines that are mixed in out and increasing the levels of molecular iodine so it's much stronger and safer, and it's amazing what it does. It's truly incredible.
I'll say too, in closing here, Jason, that for those of you that may not be aware, COVID is really on the rise right now, and flu season is hitting. And for instance, today I had my groceries delivered earlier today. I needed soup. The delivery person told me it was the 8th stop they had today with a household that they knew of with COVID. I let them know I had COVID, leave everything outside. It was the 8th household today by 2:00 in the afternoon. So using this preemptively is important, plus your safety issues, but definitely preemptively, I would definitely look into this because it's much more than a common cold, I'll tell you that. Jason, anything you want to say as we log out here?
I just want you to know, Kirsten, to let you know how special you are and what you do for the community and how hard you work and what you're doing. And here you are, where you're dedicated to your team, where here you are, you're sick tonight and you're doing what you're doing. And I'm going to tell you, and I've always said it over and over, I love you, I love you, I love you. And I'm still going to love you for the rest of my life. And I don't care how many people here heard it. I'm going to tell you, I love you. And that's it.
Thanks, Jason. I appreciate it. We love you here too. And I appreciate everybody's well wishes. So I'll be there on the other side. I'm a week into this. I probably got another week to go. But I do appreciate you all for being here. Spend a little bit of time learning about molecular iodine, because we carefully curate products we hear that we know have scientific evidence. And you're all aware of that. We don't just work with any company. So ioTech International is really the forward-thinking company in terms of antimicrobials. So I hope you'll all check them out. Thank you so much, Jason, for being here this evening.
Yeah, thank you very much for having me. And everybody hit the tap here button to reach out to me. Again, my phone number is 518-528-4445. Any of you can call me, text me anytime. I look at you guys like friends. You don't have to dial 1-800-MIX-A-LOT to get a hold of me. You'll be able to get a hold of me direct, and you don't have to speak to 10 different people to get a hold of me. So if I can help you in any way, I'd be glad to. Your office deserves IORINS because your patients do. And that's all I have to say. And thank you, Kirsten, tonight for having me.
Thank you, everyone. We're going to go ahead and close. For those of you that are here, you'll be redirected to a screen to complete the quiz for this evening. Refer to any instructions in the handout that we gave you, and please reach out with any instructions. Tomorrow night is a course on xerostomia, and Saturday we have a course on infection control. Thanks so much, everyone. Good night.